While we're talking about things like pain catastrophizing and about fear avoidance beliefs, we might also talk about some of the common treatments of them, just to give a sort of example about how we might work through some of these things. So one of the common ways that we're going to work through this sort of issue is we are going to be doing things like relaxation tools, exposure tools, different things from a psychotherapeutic perspective that are sort of designed to allow your body to sort of test gently these movements, these behaviors, these postures, to sort of demonstrate that they are safe. One of the things that seems to happen is that our brain sort of holds this belief so rigidly that you can't even like change it or fix it or challenge it. And one of the things that we often need to do is just sort of calm our bodies enough, accept that whatever sensations are happening for us are going to be okay and we're going to be able to handle this, and then actually do the movement or the behavior. So from a psychotherapeutic perspective, that's often what we're doing. We're talking about what are the drivers of these catastrophizations for you? What are the drivers of these fear beliefs for you? Where did they come from? How did you learn them? How are they sort of reinforced in your brain? How are they rehearsed in your brain? Are they bringing up anxiety? Is there a depression response? Do you have a startle response? What sort of things are happening from you from a psychotherapeutic perspective? And then we're also working with, hopefully, a physical therapist, a doctor, someone who can actually check out the structural aspects of whatever is causing you pain to ensure that whatever movement or behavior that you're going to do is actually safe. So, of course, if you've had an injury, you've fallen and you injured your shoulder, just to take an example here, we're going to work with someone to make sure that that movement is actually safe for you to do. And then from a psychotherapeutic perspective, we're going to find ways to safely address that underlying fear and catastrophizing to actually get you to take that step of trying it out and just seeing or experimenting with what that sensation actually feels like in this one example. So this mimics a sort of model that we've seen in recent years that's called cognitive functional therapy, that shows people or has people working together very closely from both a psychotherapy and a physical therapy model. And it's a really promising multimodal approach to this quite difficult issue of chronic pain that we haven't really had amazing treatments for, that we are starting to develop new and exciting ones that really seem to be working quite well for a lot of people.